Good day, everyone, and welcome to the AMSUS conference. I'm Rear Admiral Forrest Faison, the Deputy Surgeon General of the Navy, and it's a privilege for me to speak to you today. First off, thank you for your service. Thank you for volunteering to serve our nation and being part of an effort that's resulted in unprecedented combat survival in the most recent conflict. I want to talk to you for a few minutes about where the Navy's going in the future. We have two main focus areas as we look to the future and we come out of the nation's longest conflict. And those two areas are preserving our skills and competencies so this unprecedented combat survival that we've had in the most recent conflict, we will also have in future conflicts. And the second area of focus is preserving the fighting readiness of the fighting force of the Navy and the Marine Corps. And it's that which I want to talk to you about today. I'd like to introduce you to the Navy of today. HM2 Amber Barak from Linden, California is the face of the Navy today. HM2, thank you for joining me today.
It's a great pleasure, sir. Thank you for having me today.
Now, how long have you been in the Navy?
I've been in for about almost 4 years, sir.
Almost 4 years. And what's your long-term plan?
My long-term plan, sir, is to stay in the military for as long as I can, 30 years, be like my dad, and hopefully be a medical corps officer.
I understand you want to go to medical school.
Yes, sir.
Are you taking classes now?
I am, sir, yes. Hopefully I can finish my bachelor's degree in about a year and a half, hopefully maybe less time than that.
And you're married with a 16-month-old at home, I hear.
That's correct, sir.
Fantastic.
Happy mother, happy wife.
Fantastic. That's wonderful. Now, HM2, when were you born?
I was born in August 1993.
1993. So you're a millennial.
Yes, sir.
75% of the Navy today were born after 1986. They are millennials. And they are the most highly trained, highly specialized, highly educated fighting force in our nation's history. When I was a lieutenant, there might have been 10 or 15 folks that could do a particular job. Because of specialization today, there might be 2. As a result, every single sailor and Marine is critical to our mission, and we must do all we can to keep they and their families healthy. Now, HM2, do you have a smartphone?
Yes, I do, sir. Always have it in my hand.
Absolutely. 98% of the Navy has a smartphone today. Now, I won't ask you if you sleep with it, but 85% of the Navy sleeps with their smartphone today. You and your generation are fundamentally changing healthcare. And I want to talk about that because it directly impacts our ability to keep you and your generation healthy and on the job. So let's talk about this for a second. What's your favorite app on your smartphone?
My favorite app, sir, is Instagram and most likely Facebook.
And Facebook. All right, yeah, good apps, good apps.
Yes, sir.
When you want to talk to your doctor, what app do you use?
I don't have an app for that, sir.
When you want to make an appointment, what app do you use?
I don't think I have an app for that one either, sir.
All right. When you want to get medical information, where do you go?
Dr. Google.
Dr. Google, that's exactly right. Have you seen the apps in the smartphone, in the iPhone store?
I've seen quite a lot of them. They are definitely moving forward and having a lot of new ones, but nothing for medical that I have on my phone.
But you go to Google.
Google, yes, sir.
So the internet is expanding at about 7 pages a minute. A third of those have medical information, and there's absolutely no quality control over any of that information. And yet that information you're using to make medical decisions, right? Now, when you need to be seen, you got to come to the hospital, right?
Yes, sir.
All right. So how do you do that? Tell me how you get to be seen. If you were a routine patient, what would you do to come and see your doctor?
As a routine patient, I would have to call the clinic or call the 1-800 line that they have here, speak to an operator, get an appointment maybe 3 months away. Hopefully, if I need an appointment in 24 hours, I might be able to get an acute appointment. And then I come to the appointment, try to find parking, have to wait in line for pharmacy to get my medications. By that end of that process, it's been a couple of hours, and then I head home.
But you got a job to do as well, right?
Yes, sir.
And a family at home and a 16-month-old that I'm sure keeps you pretty busy.
Absolutely, sir.
So you probably don't do that unless you absolutely have to.
Correct, sir.
All right, very good. If there was a better way, would you use that?
Oh, yes. That would save a lot of time and be very good for myself and my family.
So it sounds like convenience is a big factor.
Definitely, sir.
Yeah. For the millennials, what drives their healthcare choice today aren't the things that we worried about as baby boomers. We worried about quality, safety, things like that. What drives healthcare choice today is convenience, the experience of care, and increasingly technology. As an example, out in California, where you're from, there is a healthcare organization called Scripps. Doctors use stethoscopes. You're familiar with the stethoscope, being a corpsman. The stethoscope was invented in 1832. But the doctors at Scripps have a smartphone with 2 iPads on it. And when you put it on the patient's chest, you not only get the heart sounds, you get a 12-lead EKG, an echocardiogram of the heart, and a Doppler flow study of the coronary arteries. And there's a billboard in San Diego that has a picture of this smartphone and a picture of a pretty beat-up stethoscope. And the tagline is your doctor using something from the 1800s to take care of you? So HM2, if you saw that billboard, where would you go get your care?
I would laugh first, and I would get my health care from the most up-to-date medical facility that I could find.
Exactly. That's exactly right. So what you're seeing here is we are in a model of care which is come to us. You must come to us. If you look at where hospitals got their start in the monasteries of Western Europe in the Middle Ages. And it was good. The order, members of the order would take care of the villagers who were sick. But the model was, you must come to us to get your care. That model is essentially unchanged today. You must come to us if you want to get your care. Now, we've wrapped science around it as the scientific method is taking hold in medicine. Arguably, we've made it more difficult. You must come to us when it's convenient for us. That's what appointments are all about. But the model is essentially unchanged from the Middle Ages. You must come to us if you want care. But you can see folks with busy lives who are being driven by convenience, the experience of care, and increasingly technology. That doesn't work. And so if we are going to keep the force of the future healthy, we've got to look for ways to push healthcare outside the MTF. We've invested heavily in medical homes over the last 3 to 5 years, and those are a resounding success. But the next step is to push healthcare outside the MTF. So we don't make you have to make an appointment. We don't make you have to come to the hospital if you don't need to. 70% of what goes into a primary care clinic doesn't need to see a physician. We keep you on the job and with your family. That's where we're going in the future. And so I challenge each of you to look at how we're doing healthcare and how can we continue to provide the best healthcare our nation can offer to those who serve and defend our freedom without making them come to the hospital. It will involve things like telehealth and apps. It will involve things like engaging these millennials so that we understand their world and how can we play in that world so that they're not going to Dr. Google for their information. They're coming to us for credible information. We know what the health threats are. We can address them proactively, keep them on the job, and when they're not on the job, with their family and not in our waiting room. That's the future, ladies and gentlemen. That's where healthcare is going. That's where we must go if we're going to keep the force healthy. Otherwise, we will lose to Dr. Google. We will lose to technology and convenience. And so I challenge you to think about, as we position ourselves for the future, what can we do to keep them healthy? Again, thank you very much for attending the conference. Thank you for your service. Thank you for being part of the MHS team. And I hope you have a great visit in San Antonio and a great conference.